It's all right. They can set up late and they can miss out. Yeah. Just tell me when you guys are.
Ready, we're all set. Yeah, good to go.
Okay. Hello, guys. Good to see you guys here. We're glad to do this press conference and discuss a few things, and mainly gym's reopening. And we have put together the New York State Fitness Alliance, and it's a group of clubs, owners, fitness centers, all sizes, all types, all around the state of New York, coming together to figure out how do we work with the state and put everything together to get us open sooner. But it's not just opening soon, we want to open safely. We care about here, we're obviously to promote the health of this community. We're obviously here to promote quality of life, and we believe we have a plan, and we're announcing that today, a strategy to reopen properly following certain guidelines. My name is Jeff. I'm with Athletic Apex Health Clubs here in Rochester, New York. Again, New York State Fitness Alliance represents voices from all over the state. And today I just want to share with you, we have guidelines. We believe as it sits today, we can reopen safely. We can reopen and provide a safe environment for our members to come in and work out. We're getting constant feedback from our community, from our members right now that are being affected from being shut down. And we've worked really diligently with experts, multiple experts in the field, to create these guidelines. We worked with Dr. Ravi. He's actually an infectious disease expert. He's held positions, chief medical officer in Yale. He's currently director of medicine for Loyola College in Chicago, Illinois. He's reviewed all of our terms, and he's come back and stated, I've reviewed coronavirus mitigation practices at a variety of public venues, including nursing homes, restaurants, bars, and department stores. Your proposal is one of the most thorough approaches I have encountered, and I concur and endorse your plans. We have science and facts to figure out how do we reopen safely. We have that in place, and we're ready to move forward with that. We've asked a couple of our fitness partners in the area to come in and speak a little bit about what this shutdown has done for them, their members, what they're saying. More importantly, though, how they're prepared to open right now today. We want to work in unison with the governor and his office. It's important. We want to be partners. We want to have a conversation going back and forth with what they need, what their concerns are, what their fears are. Let us come in and address those fears. Let's work with the experts, not fitness industry related experts. We agree that there's going to be a bias a little bit if they have a relationship with the fitness industry. Let's find non-fitness industry experts like Dr. Ravi. Let's address the issues and let's move forward with opening up. That's what we need to do. We need to make that happen. We need to make it happen soon. That's what we're advocating for as an alliance. The guidelines we're going to be posting, we're going to be posting online on our website. We're also going to be handing out to all of the fitness centers in the area, even those that aren't a part of the alliance. And we're here to promote the safety of opening up health clubs. I'm going to ask a couple of our Orange Theory partners, and I say partners, obviously in any community you have fitness representation. We're representing all sides of this, not big box health clubs, not just CrossFit. We want every single person to have a voice, and that's what the Alliance is about, is having a voice. I'm going to have one of them come up right now, and we'll have them take turns, and we want them to share how they're prepared right now to open and share a little bit about what their members are saying and how this closure has affected them.
Hey everybody, how's it going? My name is Don Chenault. I'm here representing Orange Theory Fitness in Rochester, and I just wanted to talk a little bit about the things that we've been experiencing so far and what our thoughts are and everything moving forward. So we believe that with the way especially that we're set up, we're able to implement all of the guidelines and all of the policies that we need to in a safe manner in order to move forward. Especially with our members right now, having to kind of modify, be outside and things. We've got a lot of feedback from members saying that they are kind of looking forward to, and they're kind of missing that routine that they had where they can, get up in the morning, go work out, take care of their health, take care of their fitness. and not just their physical health, but their mental health as well. So we just think that with as far as training staff, having all of them prepared, being able to keep track of how many people are coming in and out of our facility. So we'll have a good way to track, who's coming in, who's coming out, and all of that. So we just really believe that, given the chance that it would definitely be possible for us to make these changes in the proper way that's going to be beneficial for us and also beneficial to all of our members and the people in the community that are looking to get back and take back a little bit of their health and fitness. I'm going to introduce next another one of our coaches here. His name is Grant. He's going to come up and speak a little bit as well about everything that's going on.
Hi there. My name is Grant. I'm a coach for Orange Theory Fitness, and I'm just going to go a little bit more about what Don was saying about our health and our mental health and our physical health, and also about how people might think, is it going to be clean enough? So what we do is we clean before every class. We have sanitation, high-grade sanitation. Every member goes in with wipes. Every member will be socially 6 feet apart. We've got stuff spread apart, so nobody has to have interaction with each other. Nobody would have to touch anybody. And after class, we deep clean again. So if we've got 3 classes, you're getting before, during, and after sanitation as well. Like Don was saying, also for your mental health. People go to the gym to interact and to get their own space, their own time. And sometimes that's only time that people have for themselves. So a lot of members that I've been seeing, even with the outdoor workouts, just seeing familiar faces, they're loving it. But for a lot of us, you get up at 4 o'clock in the morning and you're at that gym at 5 a.m. That starts your day, that starts you off in a positive way. We just want our members, staff, everybody around to know that it is going to be clean. We are working towards, we're all trained. So pretty much all guidelines are being followed. Everybody's looking forward to get back into the studio. I know some people are going to have hesitations, but as time goes on and on, I think everybody's going to get back on a roll. So that's all I've got for you guys. Thank you.
As they stated, we've gone above and beyond to make sure we have a very sanitized location. Each of our clubs that are part of this alliance have agreed to the same guidelines. We're prepared to make sure social distancing is enforced, not just available, but enforced. You can't see, but where you're standing, we hold group classes in here. We've marked with enough space apart, as the medical experts have told us what needs to be done in order for people to work out safely. We have wipes that they kill all bacteria, all viruses. They're readily throughout the whole space. Sanitation is readily throughout the whole space. We're working to go not just what we have been doing, but what do we do above and beyond? We have air PHX systems. Each person in the Alliance is figuring out how do we tackle the air pathogen. That's a big concern. And in our guidelines, that's one of the things that Dr. Ravi really was impressed with what we've done. The steps we've gone to tackle that specific issue are just beyond measure. So we're prepared more so than industries that are open even right now to provide a safer, better space. And we know we can do this right now. And the members need it. The community needs it. We're ready to come in and announce fully what we're moving forward with and work directly with the governor's office to answer their questions and to work with them as a partner, as an alliance even with them. That's the key. New York tough, New York strong, New York smart. These are terms we hear regularly from Governor Cuomo. We want to be a part of those terms. We want to be a part of creating this a tough, strong state, and we want to make sure we're doing it smart. We believe as it sits today, the guidelines we have, the protocols that we put in place, we're prepared to do that smart. We're prepared to approach a very smart and safe area, and we're excited to be a part of that, and we're excited to move and start getting these doors open ASAP. And I'm excited to announce that today to you guys. I'll be glad to take any questions that you guys have specifically. And again, we'll be going through more of the specifics with guidelines. We'll launch those and get those on our website and be available for any questions you have. But the representation you're seeing here is just a small part of that. Orange Theory, we have Breathe, we have Midtown, we have LA Fitness. We're working with companies to collaborate. And this is a statement that was made by one of our, typically would be a competitor, They made the statement to me today on the phone. They're like, we need to collaborate today and be a competitor tomorrow. And that's the announcement. We're here as an industry to work together to overcome this pandemic. I mean, these are unprecedented times, but we know health is a part of what makes people stronger. We know it boosts their immune system. We know they need this. Our members need that, and we're here to provide that for them. We can do it safely, and we can do it now.
How much of a financial strain is it to have a big building with thousands and thousands of dollars worth of equipment and nobody able to use it?
It's a major financial strain on us. You know, we're doing everything we can to make sure we're set up and prepped to reopen. But you know, when you don't have usage and you don't have revenue coming in, you know, it's not just the strain of the financial for us. It's our employees. It's our staff. You know, the pandemic unemployment is gone. You know, PPP funds helped. That was a great help for us. It really was, but they're gone. We're in this limbo area as a gym, and there's not a lot of conversation. And it's not a matter of if someone's going to close down. It's going to be when you close down, and that's something that's going on across the state. People are closing down left and right now, you know, and those of us that are holding on because we're trying our absolute best to put everything we personally have into it to ease that financial strain so that once we get the okay, our members can come back and then the community can have it. But it's a really big strain.
You mentioned a couple of times about sanitizing and social distancing. I think a lot of people were probably wondering, and I know at some point you mentioned that masking would be open for employees. Do gym goers also have to wear masks? Obviously, it's a little bit harder to work out, but at the same time, when you're breathing harder, these particles are going to be going out more than 6 feet, and sanitation can only do so much. So what are you doing to make sure that gym goers are wearing masks if you're requiring them to wear masks?
That's always the toughest question, right? So we want our gym goers, all of our staff, as you mentioned, all the employees are required. We want to make sure our mask situation, and Dr. Ravi addresses this specifically, we want our gym goers to wear masks. The only exception on a mask would be if there's going to be a physical aspect that may put them in a bad healthy position or a bad physical position. So high intensity working out, what we need to do is we're establishing guidelines to where if you're not going to wear your mask because it's going to be limiting, then guess what? Social distancing has to make up for that, you know, and that's where we lean on our experts. At what point do we have to go, okay, is it mask for everybody at all times? If that's what it takes, we're willing to do that. That puts a big limit, though, on a lot of the high-intensity style workouts. So rather than do that, what other measures can we do to mitigate that? I don't think it's an either-or, and I think that's part of the problem with our conversation we've had so far, is it's either you have to do this or you don't have to do this. What I want to do is have a dialogue with experts. What's another option that everyone can agree on that signs off on? And right now, distancing is it. We have clubs in other states, they're doing 14 feet in between people when they're doing high intensity exercises, and medical experts, infectious disease, are going, hey, that's great, that's what's necessary. So I think that's the answer. It's whatever protocol has to be to put everyone in the safest position. That's what we're prepared to do right now. Masks, everyone will be required to wear them anywhere in the gym outside of the high intensity, and in the high intensity, we're going to modify all of our regulations and protocols to accommodate for not having to have a mask on. And we're still asking, actually, in our protocols, if you can do high intensity with a mask, we want you to do that, and we're asking you to do that. But if there's going to be some type of a concern, then we're going to make sure the distancing or other protocols are in place to combat that.
So Jeff, several weeks after phase 4, where do you stand at this point? You said now it's not a conversation of if gyms remain closed down, but when, that can become maybe a permanent thought. So how do you foresee, your location hanging on at this point?
We're fighting hard, but we're fighters. Fortunately, we're in a bit of a situation where we have locations in other states that are operating. So that's helping us be able to fight a little bit longer. I'm just really concerned. We work on this as an industry, and I'm really concerned about those that don't have that ability. I don't have a timeline for you right now to say, hey, in 3 months we're shut down, or in 4 months. We're looking at that right now. How far can we stretch this? Our staff are amazing. They're investing time at their volunteer to help do things to make sure that we're ready and we're engaging our members. So right now, I don't have a time. I mean, you say next year, then okay, maybe we're going to start having to have that harder conversation. But I mean, it's month to month right now. It's what can we do to supply as much revenue and cash flow into this place now to wait to maintain. And it's more about we're not hearing anything. That's the hard part. We can budget accordingly if we would just have some dialogue, and that's the part that we're missing right now.
Earlier
Day one of shutdown, we paid our employees through the remainder of that month, March. We had to furlough everybody after that until we were able to qualify for PPP funds again. Listen, all of us are being put in a bad spot as owners because our employees are our family. We don't want to furlough them. We want to take care of them. Once they got the pandemic unemployment assistance, that gave us some breathing room. Once we got PPP, we were able to bring back and start re-engaging. Now that we're out, we're back to the point where we don't have anyone on staff. No one's on payroll right now because we need to get revenue in here. We've got to get funds to be able to, so that we can wait to open. We can't open up if we have no funds while we're waiting for that date.
How many employees?
We have over 75 employees just at this one location.
How many members?
Over 5,000.
5,000 a year.
Yeah, and a significant amount of those that are on hold. Again, our members know what's going on, which has been great. Our cancellations have been a little bit more on the minimal side, but I think we've seen it across the state. But the cancellations, that part doesn't matter until it's the holds that matter, and it's the unknown of reopening. It's the fear when we could reopen tomorrow, but if our members don't feel safe, then that revenue still doesn't come in. That's why we have these protocols. They have been endorsed, and we want the governor to sit down. We want his office to look at these, and we want them to come out and say, hey, we believe under these protocols, we can do this safely so that the members feel safe. I mean, we have a leader. We want to follow our leader. We want to work with him on this, and we want everyone to feel safe. That's the goal.
Do you have any concerns at all about being able to enforce the sanitation side of things? Because, I mean, certainly before the pandemic, you'd go to a gym and there was maybe a small number of people that just never wiped down machines, sweat everywhere, and just,
Yeah.
I mean, I'm sure everybody's mindset has changed since then, but.
And that's the big thing is because there's more awareness, because of what the governor has done, and because of what all of this pandemic has brought in. I always try to find some positives. Positives are people are washing their hands more often. They should have been doing that before, but they're doing it, right? They're more aware of themselves. And so I think that that's going to be a massive help on that. But in addition to that, our staff, every single one has a new job role that's been assigned to them. I don't care if you're answering phones, you're greeting people at the front desk, you're a trainer, you're a salesperson, you're a manager, you're now a sanitation expert. When you're walking through the club, you're keeping an eye out for that. And part of what we want to have is we don't want to lose our member experience. So we want to be able to bring someone in, and if a member doesn't wipe and they walk off, we're not going to humiliate them. We're not going to say, hey, get out of the club. We're going to wipe it off. We're going to show and let us do it for you. And then we're going to pull them aside. Hey, just listen, as a precaution, this is what we're doing. As a reminder, please make sure that we follow these guidelines. This is what so that's how we're going to address it. Our staff ultimately are responsible. We're paying them, their eyes on trainers, people in the field. This is what we're going to be doing, and we're going to enforce that, but we're going to use it as an education tool for our members as well.
Speaking of that member experience, obviously not 5,000 people are going to be here at one
No.
time, but that's a lot of people. How are you going to manage having a capacity cap, and will you say that someone can only be in for a certain amount of time to mitigate that? How's that going to work?
So here's the good news on that. So people love to ask the question on that. I don't like giving out the number of members because people, whoa, that sounds like a lot. Think about how do car businesses stay alive? How many times do you buy a new car in your lifetime? Well, people buy new cars all the day. So it's the same principle here. You have 5,000 people paying for a membership, and you have less than 100 in at a time. There's a constant rotation, there's a constant movement, and we will have capacity guidelines, and we will make sure our capacity guidelines. And here's the really great thing about gyms. We're uniquely qualified not just to track capacity better than anybody, we're uniquely qualified to do tracing better than anybody as well. Someone comes in, they can't get in without checking in. We have contactless check-in, so it's a key fob. You don't touch anything, you go, you move on, it clicks you in. We know when that person was in, what time they were in, who checked in all around them, and we're able to live data track how many people are in the space, and as they're leaving, do the same thing. So we're able to easily monitor the capacity issue, and we plan to be very aggressive on our capacity on the front end. And with our classes as well, we're going to be doing reservations. Again, we don't want people to have a bad member experience, but we want to be responsible and let you know this is the number of max people we can have in here. This is what we're going to provide, and if we don't have that, we'll have it virtually. You can do that as well at your home. We know that nobody likes that as much. We've had that feedback, but at least it's there to help mitigate that a little bit.
And so I see some basketball hoops up. I also saw some varieties of other courts here. Are those going to be open too, or is it just
Yeah, so we want to really lean on the medical expertise on that. The basketball courts aren't in use here anymore. We've converted it to a turf area now. But for racquetball, I don't foresee how to make a call on that without it being a medical expert that we need to lean on, and we're going to apply whatever they say. If they've deemed that because of the exertion in the enclosed area that that's not a safe environment, then we're going to enforce that to the strongest degree we can. If they come in and say, hey, singles are okay with these stipulations, then we're going to enforce that. But we are going to lean on the experts for that, and that's why we need this dialogue coming in, because we want to make sure what are the responsible things that we need to do. Not every fitness center has the same amenities, and that's the challenge. So some that have it, we need to know what those answers are, and that's what we're working on right now, and that's what we want to work on with the state. What are your experts saying? What are their concerns with these? Let's work together to resolve those.
Could you say and spell your name for us?
Yeah, Jeff Sanders, and that's Sanders. Jeffsanders.
Jeff, your title is?
I'm the CEO of Athletic Apex. Yes, sir.
So as part of the alliance, you put together this reopening plan. I mean, this far in the game, though, gyms are very much still in a gray area. You mentioned earlier you've been in touch with the governor's office. Where have those conversations gone? Is it still full of uncertainty?
Unfortunately, yes, and it's not, and I can't get upset at the governor's office because there's a lot of conversations going on right now regarding that. But there is some uncertainty. There isn't a lot of feedback or a lot of conversation or even dialogue. It's more like, hey, thanks for the input, thanks for the information, and I believe they're taking that and they're applying that to their models that they're going to create. But right now, the biggest concern we have is we're not getting the information, or we're not getting updates. We're not getting, hey, this is where we're at. These are the things we're struggling with. We're not being engaged in that process, and we're really hoping with this alliance that we can come in and show that we want to be a faithful partner with them, and we just want to be a part of the dialogue to create the solution. Listen, the governor is not an expert in gyms. His experts are probably not experts in gyms. We have an expertise there. We're not the experts in safety and medical. That's why you get doctors and you get experts of those. Let's bring the experts to the table to create a plan that all the experts agree. It doesn't do any good to have a plan if in a fitness environment that plan is not able to be executed. It's just a plan to say, and then there's no execution behind it. So I really want us to be dialogue. Right now we don't have that, and that's what we're really hoping to accomplish with the alliance, is getting more dialogue and getting solutions rather than just more talk. We want solutions, and we want to get the places open safely now.
Here at Apex, you mentioned that, as soon as COVID hit, you started rearranging equipment in the gyms just to be ready to be open ASAP whenever that day is. Can you expand on that?
Yeah.
Why is that?
So for us, again, we want to be responsible. We want to make sure we're maintaining a member experience. It's one of the most important things to us and to our alliance members. We want to sit down and say, what are the parameters that we're going to need, and let's morph our business to fit within those parameters. So, we started moving equipment apart, everything, 6 feet apart. If we couldn't move it apart, we tape it off, when we put a sign, due to current, situations, please do not use. We've added the Air PHX system, which is another device that's really unique. It actually puts out micronized particles into the air, and it sanitizes the pathogens. And they actually did it at a level 2 bio facility. They did a blind test on corona, and it sanitizes all of the coronavirus within the air and within surfaces as it runs. We've got 2 of them in our space. So we've gone above and beyond just to make sure that once we're ready, we can get the community back involved. It's all about the community. It's about health. It's about getting them in here. So if we get the green light, once we get it, we want to be able to say, come in same time, not, hey, here's the guidelines, let's spend 2 weeks prepping ourselves for that. That's why we did that, and since then we've maintained the sanitization, we've maintained everything we've done, so we're ready to open up as soon as possible.
I got one thing, in case anyone else doesn't have anything. Your gym's been closed for a while. What is the piece of equipment you most look forward to using once it's open?
My piece of equipment is we have a really unique leg piece that we help design, leg press. It's biomechanically designed to take all the pressure off your knees and your lower back. It's one of the best pieces you can use to build leg strength without damaging your knees. I'm getting older as everyone gets older, right? And so I'm really looking forward to get on there and let's see what kind of how much strength I've lost over this time and start getting it back for sure.